Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Hello, everyone. I'm Barbara Hamley. If you're one of the 68.9 million Americans enrolled in Medicare, you have until December 7th to make changes to your Medicare Part C, D, and G plans for 2026. And if you want health insurance coverage through the marketplace to start on January 1, you've got a little over a week left to enroll. What are your questions about next year's health insurance coverage? We have some answers for you on today's Another View on Health. You can call us at 1-800-940-2240 or 757-440-2665. Is that right? Yes, that is right. Stay tuned. Another View will be right back after this national, regional, and local news from NPR.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Hamley. Do you know the difference between a Medicare Advantage plan and a supplemental plan? If you're purchasing health insurance through the marketplace, what should you consider beyond the increase in premium prices? What are your questions about this year's health insurance enrollment periods? We want to hear from you at 757-440-2665 or 1-800-940-2240. The numbers again are 757-440-2665 or 1-800-940-2240. Joining us to talk about options and answers and answer questions is Faye Rickett, health advocate and founder of Senior Health Options, LLC. Hi, Faye. How are you?
I'm well, thank you.
Good. Thank you so much for joining us. And we're joined by my co-host, of Another View on Health, cardiologist Dr. Keith Newby, who is also the market director of community health improvement and engagement with Bon Secours. And hot off the presses, first to announce, because it just happened, he is now named Chief of Cardiology at Bon Secours.
Hey.
Congratulations.
Thank you very
my
much.
Goodness.
Appreciate it very much.
And somebody just got a new degree.
Yes, I did. MPH, and I'm so happy.
Wow.
You just do not know. If I don't see another book to have to read, another paper to write, it will not be too soon.
Congratulations.
Thank you very
That
much.
is fantastic. Now, did you march? Did you go for a ceremony or anything?
It's supposed to be in the spring if you march, but
Okay.
I could care less about marching. Give me my paper.
Did they give you a paper?
Well, you know me and my usual overachiever mode.
Yes.
100 in one class, 99.9 in the
Come
other.
on.
I said, give me my 10th of a point. I'm an overachiever. I can't help myself.
Wow, that is congratulations.
Thank you very
That
much.
is
I appreciate it.
And so I know that you probably have patients out there listening going, wait a minute, he's chief of cardiology.
Yeah.
What does that mean? Does that mean I'm not going to be able to get in to see him anymore?
No, I'm too much of a workaholic. No, this is it's helping with program development. How do we serve our population the best? So that's really what I'm going to be trying to help design is how do we market what we can do and what we can provide better. That's all. So I'm just trying to help with guidance, and that's all.
That's fantastic.
We're going to still do our program development because one nice thing about the MPH, it really has helped how we look at delivering care, and then program development. And it's just really just helped make me what I think is a overall better doctor.
Okay.
So I'm going to take it and roll with it. I'm enjoying it.
That is fantastic. Well, we definitely want people to have insurance so that they can come see you.
Absolutely.
Isn't that right? So, Faye, the Medicare renewal deadline is this Sunday. September the 7th. December the 7th. What you say? You can't wait. So if you're a senior on Medicare, should you be panicked if you haven't gone through and taken a look at what you have and making some new decisions?
Yeah, you probably should have already been speaking to your broker or agent at this point in time. Sunday at 11:59 is the deadline. So if you haven't, you need to get on the phone and make a phone call. Unless, of course, you're happy with your coverage and you want it to roll over for the new year. Be very careful and make sure you're checking your mail, because there are some plans that are not renewing for the year. A lot of plans have pulled out of the market. Centera, especially, they are not doing Medicare value plans or C-SNP plans. So they have until the end of December. Actually, they got longer than that. But if you want coverage for January 1st, then you definitely need to have a new plan in place by December 7th or a January 1st effective date.
Wow.
Yeah.
So, okay, we're going to talk about the marketplace and coverage in general, but I'm going to focus right now on Medicare, because that's the one that's coming up the closest. Now, A, B, C, D, G. I found out about an F that doesn't apply anymore.
Waiting for X, Y, Z to come out next.
Okay, can you break down for us, what is Medicare A, what is B, what is C, what is D, and what is G?
Absolutely. So on your red, white, and blue Medicare card, if you have it or if you're getting it, Part A is hospital insurance. So that's hospital. Part B are doctor's appointments and things like that.
Keith likes that Part B part. Okay.
And Part D, I'm skipping C for now.
D as in dog.
D as in drugs is the other part. So A, B, and D equals C if you want a Medicare Advantage plan. All those are combined in one. Those are what you call your all-in-one plan. So you got A, B, and D equals Medicare math C.
So, but if you want C, you still have to have
You
A
have
and
to
B,
have Part
right?
A and Part B to get Part C. That is correct.
Okay, so what's the difference between having Part C, that Medicare Advantage, which is what they are promoting like crazy,
Yes.
versus G, which is a supplemental, Medicare supplemental insurance?
Right. So a Medicare Advantage plan has Part A, Part B, and Part D all combined. Usually those plans have a zero or very low premium. It also has dental, vision, hearing. Some of them have over-the-counter products, transportation, other benefits like that. So those are called your all-in-one plans, and the ones that the Jimmy Walkers and all those people are promoting, okay? And then the difference from that is something called a Medicare supplement plan or Medigap policy. Those work in conjunction with your Medicare or your Medicare plan, your Medicare Part A and B. So it helps with the 20% that you're responsible for if you have just Medicare A and B. It does not come with dental, vision, and hearing. You got to purchase all of those policies separate, and it does not come with drugs, so you have to purchase that separately as well. And then Medicare supplement plans are the same across the board, no matter what company you're with. Most of the differences is premium from company to company. So you want to make sure you're shopping for when you're looking for a Medicare supplement plan. You want to make sure that you are shopping for the best premium, and then you also want to make sure that you have, sometimes they include other benefits like a silver sneakers program and things like that, but you always want to compare the premiums on those. And then you have different letters that go from A through N, G being one more of the popular plans, because it very much looks like a plan F, like you said earlier, which is not available anymore if you were not 65 before January 1st, 2020. Okay, so you have.
That's why they didn't tell me about it.
Yeah. So G looks just like that. Looks very similar to the Plan F, except for you pay the Part B deductible at the beginning of the year. Okay.
So if you get a Medicare Advantage plan, is it more locally focused? In other words, say you have that and you have to go to a specialist that's in another state. Can you do that with that coverage?
You can. HMOs and PPOs do offer travel coverage. PPOs offer better or more extensive travel coverage because you can see doctors in network or out of network. You'll pay a little bit more if you're PPO, if you're out of state or out of network with a PPO. Be careful with an HMO, even though they do have some travel coverage. You want to make sure that the doctor is in network, or you're on the hook for 100% of the cost, unless it's an emergency.
So, what's the biggest issue your the clients bring to you? What is it? Just the confusion over what it all
Well,
means, or is it more about price? What are they concerned about?
First of all, I think they're confused about Medicare, period, because Medicare, in my opinion, does not do the best job of educating, which is why you need a person like me who can break it down for you. But then after that, it's networks are an issue. There was an issue just recently with Humana and Bon Secours, who were doing contracting, and they just got that situated, which I was happy about because I had a lot of clients waiting to see if they could keep their Humana plan so that they can continue to see people like Dr. Newby over here, which, I had to, pretty much just tell them to hold off. We should get some answers about that soon. So networks, you want to make sure your doctors are in the network. So those are some of the issues. And then as far as a Medicare Advantage plan is concerned, I don't think you have to worry too much about price or premium, but you do have to worry more about out-of-pocket costs, maximum out-of-pocket costs. Networks, again, is another issue, and making sure that your drugs are covered in the formulary.
That is key, because we talk about the biggest issue I run into, especially my heart failure patients, is depending on the plan you have, they won't cover certain meds, even though those medications may be really established as the premium that you should be on for heart failure, but depending on the cost of that drug. And if you don't make sure, I always tell people, if you go to a consultant, make sure you take all your meds with you so so you can figure out, will it be covered in the plan you choose? Because if not, then you get kind of shortchanged. Because, for the insurance company, it's all about saving money on their end. Right. And they really could care less. Well, I'll be diplomatic and say, it's been my experience that their concern is more saving money, which I do understand, because because the cost of health care is ridiculous in the United States when you compare us to other countries. And our health is worse. Right. Our outcomes are worse. And of course it costs more, so that's an issue. And so I really encourage people to make sure, I would really encourage almost everybody to have a consultant to talk to, because they really can help you navigate. Because I get confused. I've been doing it. Well, I've been doing this for a while. I won't say a
How
number.
long?
I won't say. But I'll just say that it's the understanding. The insurance game is really confusing.
Well, what I wanted to ask you is, how do you decide if you're going to be an in-network doctor or not? Or do you just say, I'll take it all?
Well, typically you would like to participate in as many programs as you can. This is the game that's played, and just to let you know. So you get a big healthcare system like Bon Secours or Cetera, anybody really, they want maximum payment for what they do.
Yes.
Insurance company want to give you the least amount of payment for what you do. So you get these two companies, and everybody's like saying, okay, that's what happened with Humana. That's what happened with Anthem a couple of years ago with Bon Secours, is because when you
a hospital will say, I'm not going to pay
health
that.
System, health system. Well, the health system is saying, you're shortchanging us on what you're giving us, and we're going to lose a ton of money if we continue this plan. You need to come up your game. Right. The health insurance company is saying, we ain't worried about you guys. We're trying to save money, and they go back and forth. And then what happens is that, and it's the same thing happened with, exact same thing with Anthem a couple of years ago. In the 11th hour, they cut a deal. Because, the thing is, the nice thing when you have big healthcare systems, when I was independent, they could care less if I stayed in it or not. Right. Because they have, I'm one doc, but if you have a health system, Bon Secours is large. Bon Secours Mercy Health. Right. Mercy's a big company. Bon Secours is a big company. So you talk about a lot of patients, and if they went out of network, patients start dumping that insurance plan. Yep. All of a sudden they start losing money. The insurance company. So that's why I seem like always in the 11th hour. They cut a deal.
Yeah. Yep.
So Faye, how do you find a reputable a person? Obviously, that
she
can come
says
to your
she's one
business,
of a kind.
but
that is true.
Exactly. but for seniors who are thoroughly confused, how do you know? Because you see all these commercials, and call this number now and call that number. How do you know what's real and what you can trust?
I would definitely recommend finding a local agent, someone who knows the market, who knows the doctor systems, the hospital systems. I really don't recommend. I just had a lady call me today. I enrolled her in a plan, and she said that she called me and said, please forgive me, but you're going to have to come back because I let somebody talk me into the plan. I won't name the plan, but now I just found out that Centera doesn't take that plan. So when you're calling in to these companies or when these companies are calling you, they don't know the ins and outs of what doctors or what hospitals are in the network. They're just looking at all of the bells and whistles of a plan. So I recommend that you get someone who's knowledgeable in your community and who's knowledgeable, who sits in meetings in August and September, and we're finding out who is in network and who is not in network and things like that. So I recommend always getting a local agent.
And when you get an agent, is there a cost to the person?
No.
So if somebody chart is saying to you, I can sit down and do this, but you have to pay me X amount of dollars.
No, we are.
That's not.
We are contracted with the carriers, and we are commissioned by the carriers when we sell plans. So no, you should not have to pay to sit down with someone.
Okay, remember that, folks, as you're listening.
Another thing is you really want somebody, because I could just tell, I know she and I just met today, but just listening to how she delivers information, you want somebody that can break it down in a way you can understand, because if you have somebody that's kind of talking above you,
that's right.
Then you won't really gain what you're trying to get. Plus, you want somebody that cares about you as a person. Because I've seen folks where they'll go to these people's houses and the conversation is, well, what's important to you? Of course, most people going to say, I want to pay the least amount I can pay. So they said they give them a nothing plan because they don't care. They did their job and they're out of there. But the issue becomes is you want somebody that cares enough about you as a person to give you the information you need so you pick the best plan for you.
Absolutely. Well, our phone lines are lit up. Let's go to the phone, 757-440-2665 or 1-800-940-2240. Keith joins us from Hampton. Hi, Keith. You're on the air.
Hello, ma'am.
Hi.
Quick question. I am 69 years old, and I'm still working full-time. I have insurance, medical insurance through my employer, and I'm collecting Social Security, have been for a couple of years. I have my little Medicaid card. I've never used it or signed up for anything. Should I wait until I actually quit working, or should I sign up this year?
That is a great question, Keith. Thank you so much for the call. Faye?
As long as you're happy with your employer coverage, I would keep what you have. My question to you is, do you have on your Medicare card, do you have just Part A or Part B?
I've never looked. I mean, I'm not trying to be funny. Let me pull it out right now.
Okay.
I think I have it with me.
So you did sign up for it when you turned 65 because you didn't want to get penalized, which is what you're supposed to do, right?
It's Medicare Health Insurance. It says Part A, hospital benefits only.
Okay, you're doing the right thing. Since you're still working and you're getting your benefits through your employer, you should not take on Part B because Part B has a premium. So you definitely don't want to pay another premium if you're already paying one with your employer. So you're doing the right thing. The only thing I would suggest for you is that about 3 months prior to you getting ready to retire or quit your job, that you start enrolling in your Part B so that it takes a couple months, especially since COVID, things have slowed down a lot since then. So get about a 3 months head start on in enrolling in your Part B so that you're ready to go to get into a different plan after your Part B starts.
Okay. Should I go ahead and sign up for the C and D and all the G's and F's and everything while I'm doing that?
No, you cannot enroll in any of that until you have Part A and Part B.
Yeah, so you have to have both Part A and Part B first, and then you can go look at your other other plans.
Other options.
And then it really also, Keith, and am I correct in this, will it depend on what time of the year he decides to retire also, or does that matter
really,
because it's a special case?
There's a special enrollment period for people who are losing coverage. So you have about 2.5 months or 63 days to be exact to get into a plan before you start getting into penalties and things like that.
Okay.
So
wait until I retire, but 3 months before that, sign up for B.
Right.
And then once I have that, go ahead and get the others.
Yes.
That's correct.
See how confusing this stuff
Thanks
is.
so much.
Okay, thanks so much for your call. We appreciate that. 757-440-2665 or 1-800-940-2240. Raphael joins us from Norfolk. Hi, Raphael. I'm sorry, Newport News. How are you?
Yes. Doing well. Good afternoon, and thank you for giving my call. I, like other people here in the area, are retired military. I have
Hey, Raphael, are you on speakerphone?
No, I'm on a Bluetooth to my hearing aid. Let me change you over here.
Okay. We just want to make sure we can hear you well.
Would that be better?
Yes, thank you. All right, go ahead.
Great. Okay, so I'm saying, I'm retired military, so I have TRICARE for life, which disqualifies me for different plans they have out there. Also, I'm with the VA, and my question is, with the changes in Medicare, which changes are there that may affect my situation where I have the Medicare, like I had Centera, but because I make a little too much for the Medicare and Medicaid as strictly Medicare, VA, and TRICARE for life, with those coverages, what changes in Medicare would affect me?
First of all, thank you for your service.
Support.
But you have VA and TRICARE for life, which means you have Part A and Part B. Medicare, Humana has the Medicare, the TRICARE for life contract. So there are actually some plans that does not have drug coverage that could possibly benefit you. You just have to be careful because when you have TRICARE for life, your bills are paid through a company called Wisconsin Physicians. So if you pick up one of those Medicare Advantage type plans with or without prescription drug coverage, you run the risk of now that bill coming to you and then you have to send that bill over to Wisconsin Physicians. So if you don't mind that, having that extra loop of getting those type of bills paid that way if they come to you. There are some extra benefits that come along with picking up a Medicare Advantage plan. Like, for instance, your Part B premium for next year. Right now it's $185. That's going to $202 next year. Humana and other companies have what they call a Part B give back plan. One of them is as high as $160 that would come back into your Social Security. Those are for people like yourself. These are USAA like approved type plans, so you can get extra money back into your Social Security, as well as other things like Silver Sneakers programs, possible dental, vision, hearing combos as well.
So he really needs to sit down with someone who can
Absolutely.
explain all the different options. Is that correct?
That is correct.
Yes, absolutely. And speaking of that, tell people how they can reach you.
I'm Senior Health Options. I am the owner of Senior Health Options. My name is Faye Ricketts, and I can be reached at 757-575-5874. 757-575-5874.
A lot of fives in there.
Yes.
That'll work.
Okay, Raphael, I hope that helps you. Thank you so much for the call. We appreciate that. Let me keep going because the lines are lit up. Greg joins us from Norfolk. Hi, Greg.
Well, hello.
Hi.
I love you guys' show.
Thank you.
Congratulations, Dr. Newby, on your 100th time in school.
Thank you very much.
And never say never. I got a feeling I'll be listening to the show next year. You'll be like, yeah, I'm in school.
Listen, I'm going to tell you, I don't know about that one there, Governor. But thank you, though.
Oh, what's your question, Greg?
My wife, thanks to great doctors, just survived a massive brain tumor on her pituitary gland.
Wow.
I'm younger than her. I'm still working, so I have my health plan through my employer. She is retired and has Medicare. She's in her rehab center now, doing great. Amazing. Doctors didn't even cut her open. They went through her nose, if you can believe that.
Wow.
Yes, that's standard.
Yeah.
But my question is, I'm juggling trying to figure out Medicare, and now Medicaid is kicking in. Who is a good source for keeping track of all that and helping me keep up with it? Because now she's going to go into long-term care till I can get a place suitable to get a nurse to come in. I live on the 3rd floor right now, and the only thing that didn't improve yet is her vision isn't back yet. So I can't take her up and down 3 flights of stairs.
So she's going to need Medicare and Medicaid. She'll have that dual. Is that
at this point? That's what I'm being told. Is that now because long-term care is done by Medicaid?
That's correct.
So
okay.
So
how do I keep all that straight? It's so confusing.
Yeah. So on your Medicare plan, you want to take it look at and keep handy an evidence of coverage book to see what they're covering. Home health care is usually covered with Medicare, as well as some skilled nursing, which is going to be done at the skilled nursing facilities. When it comes to the Medicaid side, you always want to be in touch with Cover Virginia, which is Medicaid. There's a number I can give you if you need that. But they're going to be most responsible for in-home type of situations.
Would you like that phone number, Greg?
Oh, yes. Thank you.
It's Cover Virginia, and the number is 855-242-8282.
It's called Cover Virginia, and they take care of the Medicaid coverage.
They
for
take
the
care
state
of the Medicaid side. Yeah. If you call them and just click a couple buttons, the options to follow, I believe one for medical, and then they will let you know. She has a caseworker somewhere. A caseworker could answer some of those questions as well.
Okay. Yeah, I've been in touch with Norfolk Human Services, who has been great also.
Beautiful.
But my question now then becomes, where she's staying at, they're wanting to take her Social Security minus $40 because now they're claiming that Medicaid is going to kick in where she's staying at.
That is correct. That's usually how it happens if you do not have a separate long-term care policy, which is a whole nother ballgame.
Yeah.
Okay. Okay, so I need to, because she just signed up for Medicaid, and I'm not even sure if it's all done or not. So probably this 855 number might even be able to help me with that as well.
They would. You should be receiving a Medicaid number, Cardinal Care, all of that. Yeah, I would call them to see how far you are in the process.
Oh, it's called Cardinal Care, isn't it? 'Cause I just got something in the mail from them yesterday, too. I need to open that then.
You definitely need to open that.
I just thought about you said Cardinal Care because I was like, what is Cardinal Care?
Yeah, that's Medicaid now. That started about 2, maybe 3 years ago. So, yeah, open that up, and it's probably going to give you a head start on what you're looking for.
Greg, we wish you the very best of luck, and we're glad that your wife is healing. I know it sounds like a lot that you're going through now, but at least you're calling in and getting the information you need. So thank you so much for that call. We appreciate it, Keith.
One thing that I would bring up now, his situation was a little different because you can't anticipate a pituitary tumor, but I tell people all the time, look at your general health. Especially when you're younger, if you have, chronic illnesses, hypertension, diabetes, you really need to anticipate the potential for your future and start planning because this stuff will sneak up on you. And then what happens, a lot of people will keep putting off, and then stuff starts to happen, but they weren't prepared for what they have to deal with. Like I said, his situation is different. His wife had, you can't anticipate that. But we do have a lot of people who have these chronic illnesses that then they lead into my territory of heart, and by that time you're really at high risk for a whole lot of things. So you really want to anticipate, because I'm starting to see one of the things in the public health world I've started to learn is how one thing kind of impacts the other. So we're seeing a lot of multiple illnesses that come up as a result of social determinants of health, that we have to kind of endure what we eat, all these things that play a factor. Then you start getting to kidney problems on top of the heart problems, on top of the other illnesses. So I would encourage everybody to anticipate, look at your general health. Don't blow off things like we tend to want to do. If you know you have blood pressure issues, if you are diabetic, at least anticipate the potential for a future issue now, so that by the time that comes around, you're already prepared, so you won't be stressing.
That you have the right kind of coverage.
Yeah, because otherwise, because this stuff is stressful. I mean, just to listen to my blood pressure going up, just listen to people calling in. Because these things are real issues we have to deal with. I mean, I'm just like, I am impressed. I mean, her knowledge base is like, I'm like, I don't have a clue what she was saying. I mean, and I deal with this every day. Yeah. And it's hard to understand this stuff. That's why your phones are blowing up.
Absolutely, because people need help. If you're just joining us, we're answering your questions about health insurance coverage in 2026 with Faye Ricketts, health advocate and founder of Senior Health Options LLC, and my co-host for Another View on Health, cardiologist and market director of community health improvement and engagement and chief of cardiology at Bon Secours, Dr. Keith Newby. 757-440-2665 or 1-800-940-2240. Nancy joins us from Virginia Beach. Hi, Nancy. You're on the air.
Hi, thanks for taking my call. Not a question or a comment, but more a suggestion. Another wonderful option to use for guidance with all this stuff that is so overwhelming to seniors, our Area Agency on Aging, which is Senior Services in Southeastern Virginia, has a special department called Benefits Counseling, and they do exactly what FAY does. Not to be competition, but just another option.
No, this is just, we want to give people as many options as possible. Absolutely.
And they can meet in person as they do when they come out to a center I volunteer at, but the workers can also do telephone consults, and they have saved a lot of people a lot of money. I can give you the phone number there. It's 757-963-9232. They are incredibly helpful. Another possibility would be to have Faye maybe talk about the new birthday enrollment period that Medicare is offering, because that's something that a lot of people aren't aware of. It's an additional to the open enrollment period at the end of every year. So that's just 2 bits of advice.
Okay. Thank you, Nancy, for the call. We appreciate that. What is the birthday benefit, Faye?
Nancy put me on the spot. So this is something new. Virginia just got covered with the birthday rule, and it's mainly for Medicare supplement plans. You can take a look on your birthday at changing Medicare supplement plans and things like that. So sometimes that could be outside of underwriting and things like that, basically, is what she's talking about.
Okay.
On your birthday?
Yes, it's called the birthday rule.
The birthday rule.
Well, suppose your birthday's on a Sunday.
No, it's just talking about the date.
757-440-2665 or 1-800-940-2240. Deborah joins us from Chesapeake. Hi, Deborah. You're on the air.
Thank you. I enjoy your show.
Thank you.
I have a question. My husband and I have been on the Medicare Part G for some years, and the premiums just go up and up and up. We each paying over $300 a month now.
Ooh.
And I'm wondering, is it worth it? Can we change to something else? Can we change to Advantage? Or are we just kind of stuck?
I got to ask her. Is it $300 per person?
Yes.
Yes.
Wow. Because I have G.
310.
I'm not paying that much.
That's a year.
Yes.
Well, he's 73 and I'm 71.
Okay. Okay, I'm going to let Faye answer your question.
So you do have some options. I would be very careful, though, with leaving a supplement plan for a supplement plan, especially if you have major medical issues, because supplement plans, especially the G, they cover things way better as far as you don't have to worry about finding doctors and things like that. However, with your company, I'm not for sure what company you're with, you may ask them about going to Plan N or a high deductible G. Those have lower premiums. You have to hit that deductible before the plan really kicks in. But the premium or a high deductible G is like maybe $2,800 or something like that. You're paying over that a year. Yeah. So I would look into a Plan G, high deductible, or a Plan N. You also have something called a guaranteed issue. If you were on Medicare and you first enrolled in a Medicare supplement plan, you do have the option to go into a Medicare Advantage plan for 12 months to see how you like it. And if you don't like it, you can go back to your Plan G, the same company. That'll probably help give you an idea of if you like and if a Medicare Advantage plan could work for you.
Mm-hmm. Okay.
Was that helpful?
That's a good idea. Yes. Thanks very much.
Thank you, Deborah. We appreciate it. Best of luck to you. And you bring up a good point, though. If you are in a situation where you already have an ongoing medical situation and the insurance is taking care of it, should you stay there?
You definitely should, especially with the Medicare supplement plan, because those require underwriting. And it's hard to get into a Medicare supplement plan if you've had strokes or diabetes or on certain medications. So if you have a Medicare or supplement plan, it's best to stay. Now, Medicare Advantage plans, they don't really ask any medical questions anymore. It used to be they could ask if you had end-stage renal disease, but you don't have that anymore. So you can always probably get into a Medicare Advantage plan, but if you have multiple issues going on health-wise and you have a Medicare supplement plan, I would probably stay there.
Yeah, 'cause they get that's where they get us for the Advantage plans, because where they kind of charge the healthcare system to try to keep cost control. So that's why they don't ask a bunch of questions, because then we start losing out if a patient comes in and we can't control their medical conditions. So that's really and really a lot of things that we run into. If you really think about it, most of the chronic illnesses that we run into, or even you look at certain cancer rates that come about, some of it's genetics, but a lot of it's lifestyle. And if we could control the lifestyle, we could control a lot of the medical conditions. So I really try to encourage people. Yeah, really bring it down. So you're finding that A, your health is going to be better in general, but B, you're coming out of pocket less because you're healthier. And that's why we try to get people while they're young, just, to really look at some of these things, get rid of the tobacco and all the other things we do, and try to eat better and exercise more, things that we know we can control. That keeps those costs down, because then when you get older, you're not as bad off from a health perspective.
Alan joins us from Hampton. Hi, Alan. You're on the air.
Hi, good afternoon. Could you speak a little bit more to the advantages of the straight A and B plan with like a supplement, speaking to sort of access to the specialists that you want and not having to go through a gatekeeper for those types of things? I'd appreciate that. Happy holidays to you too.
Happy holidays to you too, Alan. Thanks for the call.
Thank you. Yeah, with Medicare supplement plans, as long as the doctors accept Medicare, you don't have to worry about networks. I think that's the biggest advantage. The biggest disadvantage, I think, is just premiums and affordability for some people. But and then another disadvantage would be you have to add all the other things to it: dental, vision, hearing. You have to add a prescription drug plan as well. But once you have a plan, to be able to walk in and out of hospitals and not pay a copay is a beautiful thing. You do have to also worry about, the percentage of it raises every year. The premium could raise 6 to 9%, sometimes 12%. So you have to be careful about that. Make sure you are watching the notices that are coming in from these companies, because they'll tell you what they're going to be for the new year.
Yeah. Thank you so much, Alan, for the call. We appreciate that. So I know we've been focusing on Medicare, and the Affordable Care Act, the marketplace, is still up in limbo, because we don't know if at this point everybody's anticipating their premiums are double, triple, what they have been.
I think one of the big questions it would be, how is the big beautiful bill going to affect people as relates to Medicaid, Medicare, any of the other plans? I mean, I think that's a legitimate question.
Yeah, I think I'm on a lot of different Medicare, Medicaid forums, mainly Medicare. To be diplomatic, so Dr. Oz he is an advocate for Medicare Advantage plans, Medicare period. From my understanding, he has a Medicare Advantage plan. So with him in office, I think you can see, I'm starting to see positive things happen. I sat on a live call from a congressman talking about Medicare the other night. So I think they want to work it out for the better. I think that's I'm seeing some hopes and some glimmers of hope, I should say, for some positive things to be happening outside of the big beautiful bill, as far as working things out for the better for Medicare.
Is that bill though? Is that affecting more Medicaid kind of funding, or is it?
It's affecting both. There's something in for example, Centera is a good example. They had this plan that had $100 for food cards, and you got another $130 for over the counter. Wow. It had transportation. All that stuff is called VBID, value-based insurance design, right? So they were able to get all of these other benefits inside of these plans. What the big beautiful bill did was take a lot of that out and put it under the SSBCI portion, which is supplemental benefits for the chronically and especially ill and things like that. So now that's going under the Medicaid portion. The problem with that is can you qualify for Medicaid? They're raising how much it is.
How much you can make,
the general answer is yes. The big beautiful bill is affecting a lot of that, and that's why you're seeing plans leaving the market, especially PPOs. That's why I have a lot of mad clients at me right now, because I can't get them a food card because all of that stuff is going away.
So if you're looking at the marketplace, since everybody's assuming at this point your premium is going to go up double or triple, what else should you be considering in terms of selecting insurance? I was reading one article where they said, well, you should get either catastrophic or bronze because you should have something. But my goodness, the deductible
it's crazy.
is thousands of dollars.
Yeah. So I always use a method called NEED, NEAD. Need. What do you have now, right? Are your doctors in the network, whether it's an HMO or PPO? And then E is, what do you enjoy about your plan, right? What can you add to it, or what aren't you getting from your plan that you would like to see? And then the A, which is add, what can you add to it, right? And then D is decision. Is there anybody else who's around you that can see the bigger picture outside of yourself? Can they help you make a decision based on those things? So you want to not only, of course, premium is number one, affordability is number one, but you want to make sure your doctors are in network. You want to make sure your prescriptions are on the formulary. Those things are very important. And then, unfortunately, you're just going to have to bite the bullet as far as whether it's a premium or a bronze plan or a platinum plan or a silver plan. You're just going to have to figure out what's important to you as far as the premiums and things are concerned. But you want to make sure that your doctors and all of that stuff, and you consider your health needs as well, like Dr. Newby was saying. You know, some people have a lot of chronic conditions going on, and you're going to make sure those are covered.
See, if someone has looked at the medications you've already prescribed and they're on tier 2 or 3, which means they're going to cost more. Should they come back to you to say, hey, doc, can you make this a generic so there's on one so I can afford it?
Well, they do. Yeah, they do that all the time. Now, the issue becomes is whether or not you're going to get the same benefit from
and
that.
That's my question.
Where the problem comes in. It's not so much the generic drug itself as what the drug is. So, you know, and I go back to heart failure because there's a drug called Entresto that we use a lot of. And unfortunately, it's a combination pill, valsartan, and something called sacubitril. And that combination pill does have a lot of good data in terms of heart failure management. Now, the valsartan is a generic drug, and you can get that by itself, but the sacubitril adds that little extra something that really does help people more. And clinically, you see that and it's clear in the data. The issue is Entresto is just going generic now, but, you know, most drugs, even when they go generic, they still cost a ton of money for a while because everybody is trying to get their, you know, pound of flesh out of from a money perspective. The issue just becomes is that drug just as effective? And we run into this issue where the drug companies always will say, oh, yeah, that drug's just as effective. You need to tell your doctor to, you know, this is the game that's being played.
That's the piece I have never understood is how does the insurance company get to override
because they're
what
paying
the doctor
for it.
says?
Because they don't care what we say. I mean, I'm just being honest. They could care less what we say. They say, I'm going to tell you, and I'll give you a quick story. This was a few years ago. I had a patient come in that told me that the insurance company said, you know, they'll say things like, you know, if it's, say, a drug that's a different tier or they don't approve it, they say, all your doctor has to do is fill out some form and we will immediately approve it. They say that stuff.
Appeal,
yeah, you know. And so I said, okay. And the patient came and told me, I said, well, that's a bunch of nonsense because I said, but that's okay. I said, I'll tell you what. Let's call them right now while I'm in here with you and let's see what they say. You know, and I had them call the company while I was there. Listen, I said, put me on speakerphone. They said, all your doctor has to do is tell us to approve it. We'll do. I said, approve it right now. This is Dr. Newby. Hold up now. We have to do X. I mean, then the backtracking started because I knew it was a bunch of nonsense. They say that and make it sound like it's us not doing something. And then they'll even do things like a patient will be on a drug for 20 years. It's been doing wonderful on it. And they'll say, so we're not going to pay for that anymore. The biggest problem is that the patients, they don't push the insurance company hard enough, because they'll push us because we're there. See, they're in the ivory tower of the insurance companies. You can't get to them. That's the issue. If I have somebody is like, unusually stable on the medicine, why would I want to change it? And I hear them, but we've typically before, I don't go straight to a brand name drug. I'm going to try the generic first. I've already tried those, and they don't work as well. So that's the kind of the issue that we have. We're trying to give them the best because you know what gives the best outcome.
Right.
It's just that battle we have with them can be unruly.
Let's see if we can get one more call in before we run out of time. Brett joins us from Chesapeake. Hi, Brett. You're on the air.
Hi there. I'm retired military. I'm 63. I have company insurance. I have great insurance. But I also have TRICARE as my secondary. My understanding is at 65, I roll off of TRICARE and roll on to Medicaid, Medicare. Is that something that automatically happens, or is that something that I have to do, or what?
So you just have do you have TRICARE Prime? You don't have TRICARE for life, right?
I think TRICARE. I retired in 2004, so I've had it forever, but I always use it as my secondary.
Right.
I think it's TRICARE for life, I think.
Okay. Well, TRICARE, they're tracking you, so they will give you documents to let you know when you need to roll over to your Medicare A and B. Well, you should probably already have that. Do you have that already?
Well,
She's 63.
Well,
some people have that earlier.
I'm a military ID. My retired ID card. It has medical until January 31st, 2 years from now.
Yeah, so that's how they know that you're going to have to move over to Medicare Part A and B. So just pay attention to those documents that will be coming in from TRICARE, because I've sat with people who are starting to get those documents where they need to move over to Medicare A and B and to look at other insurances if they so choose.
Okay.
Yeah.
So when I do move over to TRICARE, off of TRICARE onto Medicaid, Medicare, if I am still working, like the gentleman that was talking earlier, I could have that and just not use it until I actually physically.
That is correct.
Stop working.
That is correct.
Okay.
You're in a good spot.
Well, thank you very much.
You're welcome.
Okay, thank you for the call, Brett. We appreciate it. So what is your overall advice to people in terms of picking their insurance plan for 2026?
Just like I said earlier, needs. What do you have now? Is it working for you? If it's not working for you, what do you need to add to it? What do you enjoy about it? What's missing? You want to make sure you include people who care about you and know about your situation to, get other people's opinions. Am I missing something? Type of questions. Mm-hmm. And then the biggest advice is to call me or call someone like me. There are other agents out there who really care. I care about my clients. I have about 800. I'm in 19 different states. I travel all over to go see my clients. And I pour a lot of time into my clients. And I always ask them to trust me. I'm always try to give you the best. The most that I can give you with the lowest, cost, but I want you to have quality over quantity.
Wow, that's incredible. So I'm amazed you had time to join us. Thank you. Thank you. We appreciate that.
I think the importance of it is, and I can't emphasize this enough, be prepared. Understand what your needs are for sure, but look at your health condition and what can you do to improve it so you don't have to rely on insurance as much. Sometimes you're just stuck in a situation you can't help it. But anything you could do to put yourself in a better position from a health perspective, you can never go wrong with that.
I think that's most important. Just like the doc said, you just got to make sure you're doing your part. Insurance should be secondary.
And if you cannot get to someone before this Sunday, if you are on Medicare, then whatever you have just rolls over?
Not necessarily. Okay. People get stuck on December 7th as the annual enrollment period. For people there are people out of town, people in hospitals and situations where they cannot make a decision by December 7th. You have October 15th through December 7th is the annual enrollment, and then January 1st through March 31st is the open enrollment. So if you already have a Medicare Advantage plan and you don't get to make a change right now for whatever reason, you still have January to March 31st to make one more change. So you hopefully, and for people who are losing their coverage altogether because plans are exiting the market, like for instance Centera, you have time. So relax and give me a call.
And tell us that phone number one more time.
That number is 757-575-5874.
So Dr. Newby, it's the holidays.
Yeah.
People are eating. People are imbibing. People are having a good time. What do you want to say to folks? We only got a few minutes left, but what do you want to tell people about thinking about their health during this time period?
I think if you look at, understand your health condition. If you do, and now we know people are going to eat what they're going to eat during the holidays. I mean, but know how to turn it off. If you ate too much on Thanksgiving, turn it off till Christmas, and then you're going to eat some on Christmas. You just want to make sure you understand what you're consuming. Unfortunately, so most of what we consume in our community is going to be high salt, high fat, high sugar, and that's just how the world works. Mm-hmm. But I think if you kind of ask yourself, okay, if I do this, today, I need to turn it off tomorrow. So because of the potential, because you will shoot your blood pressure up. I guarantee you most Thanksgiving dinners have shot people's blood pressure up 40 points easy. And really, and this data shows that a teaspoon of salt, can shoot your pressure up almost 40 points. And it's proven in the literature about how that could work if you were to consume that immediately. And most of our foods we eat for these types of holidays do have that plus more, because a teaspoon of salt is 2,300 milligrams of sodium. So if you hit that all at one shot, it can really do it. So you want to just be aware of what you're eating, understand the dynamics. You're going to eat stuff. I mean, let's keep it real. But I think if you know, okay, you have it, let's cut it off for the next day because of your conditions. And if you do, keep a check on that blood pressure. Don't avoid it, because people will sit there and leave their blood pressure cuff at home. They leave their blood sugar glucometers at home. And I'm like, that's not going. You can run, but you can't hide. And what you don't want to do is go to somebody's house out of town, knowing your blood sugar was 300 before you went, to go up to 800, and then you're going to be in the hospital and inconvenience everybody because you chose to just go somewhere, knowing goodness well you already sick. I mean, so be mindful of your health and really take heed and take things with you if you're going to go out of town, so you can keep a check on things and know if your pressure goes up, okay, I got to cut it off for the next day. So
don't leave your equipment at home.
I mean, and people do that all the time. Leave their CPAP. If you got sleep apnea, do not leave your CPAP at home. I know you try to make excuses not to take it with you. Take it with you. You'd be surprised.
You'll be good.
You'd be surprised. So we really, and we say this because I joke around a lot, but this is the serious part. I care about your health, and you know how I am with that. I mean, I will be there to the bitter end with everyone, but I need you to really help yourself. I can help, but only so much. It takes you to do the rest.
Absolutely. Faye Ricketts with Senior Health Options, LLC. Thank you so very much for joining us.
Thanks for having me.
Dr. Newby, congratulations.
Thank you
I know you are going to just celebrate this whole season long.
I mean, I'll tell you, my stress level has taken a nosedive. I mean, I went home the other night. I said, man, I don't have any classwork to do. What am I going to do? Nothing.
I know. You're like, what am I going to do?
Oh, that's okay.
Thank you so much.
Yeah, and Faye, you were the bomb. I mean, I'm going to tell you, you explained, you
really
broke that stuff down to even somebody me could understand it.
See, there
I was impressed. Thank you.
All right. And thank you, audience, for the privilege of your time with us today on Another View. You can listen to this show or any of our Another View programs at whro.org, on Spotify, or wherever you go for your podcast listening pleasure. Next week on Another View, the final roundtable of 2025. Our panelists reflect on events this year and look forward to 2026. Our theme music is an original composition created especially for Another View by Jay Sinnott. Lisa Godley is our show producer. Jordan Christie is our audio engineer. And Dr. Barry Graham answered our phones. I'm Barbara Ham Lee. Have a wonderful weekend, everyone. And let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever. Whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.